Nigeria yesterday joined a growing list of countries that now have the capacity to vaccinate their citizens in order to provide some form of protection against the COVID-19 pandemic. 4 million doses of the Oxford AstraZeneca vaccine developed by the Serum Institute of India were delivered to the country's top health officials at the Nnamdi Azikiwe Airport in Abuja. And the development seems to have given everyone an emotional lift, including President Muhammadu Buhari, former Vice President Atiku Abubakar, and a host of other stakeholders. Health sector analysts say the arrival of the vaccine represents progress and are calling on government and the private sector to ensure that Nigeria makes the most of this opportunity. Well, joining us now from Arise Abuja studio for a conversation on what needs to be done to achieve the desired objectives of an immunization rollout is Professor Abdusalam Nasidi, a physician with more than 32 years of experience in clinical medicine, public health, virology, and the development of vaccines and biological products. Professor Nasidi, good morning and welcome to the program.
Good morning.
Good morning. Brother. Good morning. It's good to have you on the program.
Good morning, Nigerians. Yeah.
Thank you very much indeed.
Well, thank you.
Yesterday, we were told Nigeria recorded a landmark moment and made significant progress with the arrival of the COVAX facility vaccines. We have also had the Secretary to the Government of the Federation and the CEO of the MPHCDA are saying that Nigeria is prepared and the delivery of the vaccines at the inoculation level will go smoothly. But as someone who has been involved in this line of business and who was formerly in charge of the NCDC, what other priorities do you think that those managing the process of this vaccination rollout that we expect, what should they consider? Where are the loopholes? What are the things that we need to work on so that we can have an effective rollout and immunization program?
Well, thank you for having me and trusting me to come and talk on this very important topic. As you are all aware, our country is challenged by so many security issues, and we tend to forget that one of the most serious security issue that is afflicting our country today is the health security, where we are having a pandemic side by side with some other epidemic outbreaks. Therefore, any opportunity or a chance to find solution to any of these problems is a very huge step forward. And we are very proud that at least we can now beat our chest to say we are going to join the Committee of Nations that will start vaccinating the population against this dreaded coronavirus or COVID-19 disease. As you rightly said, it's easy to start celebrating that the vaccine had arrived, but the implementation aspect could actually surprise and shock anybody. But luckily, we have world of experience. And I want to start even by the early 40s, late 50s, 60s, where Nigeria excelled in mass immunization campaign against smallpox. So we showed the world how to do it in some areas. Then polio came, that we dragged, and we're almost the last country to eradicate polio. We're lucky. Both public, private sectors, NGOs came together, especially Rotary International, and we faced that challenge and we conquered polio. So with this on ground and the struggle we had against polio, luckily, it prepared us a little bit to be able to handle this new vaccine. In place, the most key and what we needed to be ready is in place, even if not 100%, but at least we can say we have enough storage volume to handle the 4 million doses that have come in without any strain on our routine immunization, because we shouldn't allow this to affect seriously our routine immunization and set us back in all the gains we have been making. Therefore, the challenge will now be logistics and how do you mobilize Nigerians to accept fully that this vaccine is very useful. We are all aware that a lot of Nigerians are still not believing in COVID-19. And even some unfortunate incident is that some chief executives of some states are still in denial. So generally, I will say, we shall not have big problem if we now build on what we already have on ground, like all the mechanisms we put in place to fight polio, and then the new vaccines that are coming will demand even more full cooperation, not just of the healthcare workers, but of the Nigerians as a whole.
Thank you, sir. That point you made about routine immunizations going on unhampered is so important, because we've all seen how even routine medical checks, cancer tests and what have you have fallen by the wayside due to COVID. So I really want to stress that really excellent point that you made. But now, even using the polio vaccination rollout model or any other model, how will the vaccinations be distributed between states? What model is going to be used?
The luck we have is that the AstraZeneca vaccine that we brought is a very stable vaccine comparatively. It's very stable even at room temperature for some few days, so you can store it for months and just ordinary fridge at +2, +8. So, the logistics of handling it, in terms of, getting the vaccine in the right quality condition, right into the arm of the vaccinee is very key. So moving the vaccine from one place to from the central store to the zonal store to the state store and finally to the primary healthcare vaccination centers is so important that we need to put in place mechanisms that will ensure that we don't end up with good product produced in Europe or India brought to our country, and then we end up putting the wrong product into the arms of Nigerians. So there must be in place a mechanism to do what we regard as quality assurance. Not just say we have everything, we can do it, we're already doing it, but this is an added job that we are putting on the healthcare workers. But I'm very proud to announce that Federal Minister of Health has led through the MPSCDA on mass training. I think many people didn't know about this mass training of those who are going to handle this vaccine. Therefore, what is left is to ensure that the logistics are adequate, not just 50-50. The healthcare workers are motivated and not to have the experience that we had during the polio immunization, where there are incidents of, pilfering, incidents of, discarding the vaccines and bringing records, and so on and so forth. So I think, to make sure that we succeed side by side with the routine immunization, we now have to merge, the quality assurance of both vaccinations, not just on the COVID one, but we enhance quality assurance, get healthcare workers, security officers going around and making sure that the healthcare workers abide by the protocol and the vaccinates get the right vaccine.
All right, real quickly, sir. In a country where we have logistical nightmare and challenges, the AstraZeneca vaccine is a two-shot vaccine. How can we ensure that people that take the first shot will still get to take the second shot?
Well, as we are aware, the 4 million doses coming in means it can, if you go by just 2 doses, it can immunize only 2 million people. And that means we're going to have less than 2%, 1.9% of the target population, which is about 160 million Nigerians, are the target population that will be getting this vaccine. Now, if we are to go by 2-dose vaccine and you don't have good record keeping, it will be a great tragedy. But we are lucky. One, that the MPSCDA has launched a platform, a website, where you can go and register the date you are going to be immunized, the site, everything is given to you. And as you are being immunized, they will give you the next date you should come back for your second dose. But what we don't know is maybe because we have a large population, now almost 206, 209, they are saying million, we might do the experiment that the UK, United Kingdom did to spread the time which you can now go for the second dose. That is, instead of coming back in 2 weeks or 3 weeks as recommended by AstraZeneca, we can expand our own period to up to 12 weeks as UK did, or even more. And therefore, we can now give the whole 4 million doses to 4 million Nigerians. And by God's grace, before May, we shall now get another batch, and then we give you the next dose. But for now, we are sticking to the recommendation of the manufacturers. And with time, the Honorable Minister, I'm sure, will announce to the nation the way forward.
Well, Prof, one concern that has been expressed is what exactly the strategy is for the rollout. And some people have said they hope that this will not be a centralized, Abuja-based program. What kind of coordination will you suggest between the federal government and also the state governments who were not represented yesterday at the reception ceremony for the first batch of vaccines? And then we've heard a lot about what role the private sector can play. How does the private sector come in this regard?
Okay, thank you very much. In fact, we also observed that the small mistake was non-involvement of the state stakeholders and then the NGOs. And even some representative of Nigerians should have been at that welcome. This is to show that it's not just the leaders that are welcoming and accepting the vaccine, but everybody. So we also know that the best way to succeed is not to make it just a pure government activity. And the moment you just say you are doing advocacy, immunizing only the leaders, political leaders, and so on and so forth. You don't leave those. You don't do those who are really with the masses, the traditional, rulers and some religious leaders are very influential. You might have most of your vaccine stored, and with few people coming for immunization. So you're absolutely right. We should have invited the private sector. Secondly, the private sector and the NGOs always play very major roles in mass campaign. We saw how Dangote Foundation, Lumelu Foundation, Bill Gates Foundation, BUA and others, assisted with the polio eradication. I think it's the same coordinating mechanism that we are going to put in place to make sure that everybody is carried on along, and we don't miss out in proper coordination and delivery. Now, the last is coordinating from the federal to state and to the local government level. The mechanism that we use for polio is also in place, and I'm happy that I can assure you the cold chain, that is now being built and improved on. At least to some extent, we know that 70% of the cold chain is perfect, very strong, and those that are left, efforts have been made to put even solar up to the rural areas where some of these vaccines can be taken. Another way out is to embark on mobile immunization. Have mobile immunization units mounted on vehicles and going to difficult to reach areas. I think this will really assist. But in all countries, the lead in coordinating is the Minister of Health, and the Minister of Health will coordinate effective response.
Prof, on that note, let's take a quick commercial break, and then we'll come back and the conversation will continue. Please stay with us. Welcome back to the morning show here on the Arise News channel. Our guest is still Professor Abdusalam Nasidi, Professor of Virology. Prof, thank you for staying with us. You were making a point about the role of the Ministry of Health.
Thank you.
Before we went on that break.
Yes. Yes.
Please go ahead.
Yes. I was just answering the question on coordination. And I was saying it's very key to success is a very defined, well-defined central command system. It's very important. It's a mass campaign. It's like actually going to the war front and fighting an invisible enemy. now you have the tool to fight it. So it shouldn't be disorganized. It has to be really fully coordinated. And we believe the best way to do it is to have the Minister of Health as the real commanding officer that is making sure that no part of Nigeria is left unimmunized at the end of the day when we have all the vaccines we need to immunize the target population. So this. Then secondly, I was also making a point on immediately involving not just this but traditional rulers. We all know the role of these people, especially the Sultan of Sokoto, when we are having big problem with getting polio out of Nigeria. The moment we mobilized the Sultan and he came out openly to start campaigning, everything changed. So it's very important to involve this group of leaders, the Obas, the Obis, the Emas, the Sultan, to really be in front to convince Nigerians that, one, we shouldn't let our guard down. The disease is still, spreading and it's still killing people. But now that we have this tool, everybody must come out and, support the government in this effort to fight and stop this, the menace of this disease.
Thank you, sir. So there's this, the argument or the conversation about the importance of a uniform, equitable rollout is a global one and a national one, like you've just observed. But what do you make of this argument that says that why it's important globally is such that the rich nations or the Western nations or what have you that have rolled out their vaccination plan way ahead of other countries like Nigeria, that their people, even though they've been vaccinated, might still be vulnerable because the virus will mutate when it's under attack because, it's intelligent, unfortunately for us. Does that also apply in the national context, whereby we have this 4 million doses so far, even if, as you say, we're able to stretch it out till May for the second dose, only a small fraction of the population will be vaccinated. Will that encourage the virus to mutate before we get more doses and so that the AstraZeneca jab is not obsolete, like it has been proved to be in South Africa?
Well, that's a very tough question, and thank you for bringing it out right away. One is the fact that it's better late than never, and at least we have started, and that we are lucky because the issue of what they call vaccine nationalism, where the manufacturers or the developers of the vaccine, the manufacturers of the vaccine initially were all in the developed countries, and you could see that their governments came out and said, no vaccine leaves our territory until all our people are immunized. So we that are low-income and middle-income countries that are vulnerable, we were in a situation where we would have been in big problem if they immunized their people all fully, and we have not started, or we have just immunized a fraction of our people. But what we want to say is that they have the right to their vaccine nationalism, and we can't blame them. But what they have to know is that if we are not fully immunized, they too can be fully immunized. So except the whole population, the vulnerable population of the world is covered, that virus will still be there, and it can continue doing what you are saying. It can keep mutating, and it can transmutate with a very deadly variant. Unfortunately, this is already happening, and we know about the UK variant, the South African variant. Now we are having Brazilian variant, even some Nigerian variant is being questioned, and most likely it's already existing. So we pray that these variants don't transmutate to a stage whereby they become more virulent than the parent virus, the one, the SARS-CoV-2 that we know. So, but what is very important is, and the good news is what has been proven by UK and Israel, that even the transmutated variants, this vaccine is capable of at least reducing severity and reducing death. So if we can have this vaccine to help us reduce severity of the disease and reduce death, that means that we can defeat the disease. So that's why all Nigerians should rise and don't take it for granted that if the vaccine comes, everybody will be protected. Even countries that have immunized some millions, like the US, they are now seeing in some focus, some locations that some of the variants are really coming up and increasing the frequency of infection. So instead of having this dip, that the peak was already going down, they are now seeing that it's plateauing and it's going up a little bit again. So it's not yet uhuru, as they said, but I absolutely agree with you. The 4 million doses will immunize only 1.25% of the target population. And people will say, oh, that means nothing. But it means a lot, because it will go a long way in sensitizing Nigerians to show that the government is doing something to address the problem, and that people should start putting together both the non-pharmaceutical interventions like washing of hands, using your face mask, and maintaining the social distancing side by side with immunization. And that's what worked in the UK.
Okay, Prof, real quickly, a lot of people are not talking about this. How long is the immunity this vaccine going to give us? Because nobody's saying anything about it. Normally, we know viruses, once you get them, you get immunity for life. But COVID, the immunity is temporary. How long is the immunity of this vaccine going to last?
Well, it's a new virus, it's a new vaccine. So this is why, nobody can come out and categorically tell you the immunity is going to last so long. We just started immunizing, and we just started actually come into contact with the wild virus also. So the speculations now is just we only have with speculation is that it could last just like the flu vaccines, maybe 1 or 2 years. But at the same time, even if you have the tail end of the immunity, and another wild virus enters you, you could have a booster effect. So those who are immunized, even if they have lower immunity, they will not definitely come down with severe infection and the deaths that we are so afraid of like before. So no one can tell you categorically how long it's going to last, but they know it will last beyond just or around how the flu vaccines are proffering immunity.
Prof, we have just 1 minute to go, but there's something that people have been talking about. Why is it that the prediction that Africa will be a major disaster zone for the pandemic, that prediction has not come to pass? What is it that is protecting us in Africa compared to other parts of the world?
Well, you can start by praising the Lord. You cannot rule that out. Lord has a way of protecting his own. So, but at the same time, we believe we must have been exposed to some of the viruses or similar viruses, and then that prediction was, knocked off. Then secondly, we also had very many events that brought mass coming together and so on and so forth. So the virus circulated quickly, like all these NIMS and NIN something. So maybe we had it advertently, luckily, herd immunity that has come to play some role, and also the fact that we have very poor recording. We might have more cases, more this, and we don't know. We are not counting properly the cases. We are not counting properly the deaths. Thank you.
Thank you very much, Professor Nasidi, for joining us on the morning show.